Hey guys, what's up? Today I'm going to be taking you on a journey with me where I attended a course recently. It's called the Oral Surgery Cadaver course for general dental practitioners. It's run by Dr. Mohsin Ali and Dr. Saheed Hamid. It was phenomenal. Kind of start to understand why as you watch this video, and it consisted of 6 webinar days where we spent about 2 to 3 hours where Dr. Mohsin and Dr. Saheed basically gave us all this information to use on a 7th day where it was a hands-on, full-on day where they provided cadaver heads for us to practice all that they had taught us throughout the webinars. Honestly, I learned a lot and I hope you guys enjoyed this video.
Hey, what's up guys? So I've got my notes on the big screen, I've got the slides and the lecture on the laptop. It's actually really good. It's we've covered so much already: uncontrolled diabetes, unstable angina, stable angina, how to deal with a lot of these patients who are on anticoagulants and all sorts. We're only like 20 minutes, half an hour in, something like that. So anyway, I need to go and focus. Catch you guys in a bit. And then just before I go, I'll just give you guys a little fun fact that I didn't know about. 2 things. One, apparently patients who are on warfarin should avoid pineapples. Didn't know that. The other thing is that you should avoid mucosa-borne dentures for patients who are at higher risk of hemorrhage. It increases the chances even further. So really you want to wait 3 to 4 months before you make a denture for them. Anyway, in a bit guys. Hey guys, what's up? So day 2 of the oral surgery course by, oh my god, how embarrassing. My volume wasn't muted and I was like, hey guys, day 2. Now I'm just self-conscious that I'm not on mute. Just staying in my garden for the 2nd day. Weather's really nice, and today we're covering local anesthetic. He's just talking about the Galgate at the moment and actually how it's less commonly used. I actually really wanted to learn how to do it though, but I don't know, maybe he'll teach me anyway. So that's the end of day 2. Again, really information packed. I'll give a few tips of what I've learned. 1, the mesiobuccal root of the upper 6s may be innervated by the middle superior alveolar nerve. You might need to anesthetize slightly anteriorly. Sometimes you might anesthetize the posterior superior alveolar nerve, and that might not be enough when working on a 6, let's say doing an endo or even extracting. Another one, do vertical incisional drainage or incisions when doing incisional drainage of a dental abscess, and never let the sun go down on a dental abscess. And 3, there are certain medications that you can give or may be given to someone who has paresthesia, especially longer term, to allow them to potentially regain their proper sensation. So for example, if you've damaged the nerve, again, refer. They may be given steroids. Another one, give mepivacaine or articaine in areas of periapical pathology or even dental abscesses if you're struggling to get them numb. 5, invest in a intraligamentary gun or injector. They're like £15 and they can really get you out of a sticky situation. And 6, if you leave a root in a sinus, let's say you create an OAC and push the root into a sinus, of course refer them. It would be best to be able, if you were able to remove the root straight away in that session. There are certain techniques that you can basically remove the root straight away, but if you don't, you have to refer, and it's better to have that root removed eventually because it may cause chronic inflammation within the sinus. And yeah, okay guys, I'll see you guys in day 3. Take care guys, bye. Hey guys, what's up? It's like I'm doing tour de Gawi's residence. Every time you guys see me, it's another day, another location. This is my attic or loft, depends on how you say it or where you are in the world. I've got Zoe with me here. What's up? This day we're kind of going through how to actually extract teeth, so it's actually really good. He's taking us through actual videos of him removing teeth and talking us through each step. So it's actually really good which instruments he uses. We're evaluating the radiographs and giving us some tips on how to approach a lot of these extractions. So yeah, it's really good actually. What are you saying?
It's actually quite interesting. I don't really like oral surgery that much, but like watching the videos can be quite satisfying, like watching the teeth come out. Knowing I can't do it, it's quite sick.
Yeah, well, anyway guys, catch you guys in a bit. I'll catch you in the end as usual, giving you guys some tips of what I've learned today. Take care guys, bye. What did you just say?
I was looking at the x-ray, I was like, 8 are the rudest teeth, because they have no social awareness or personal boundaries. Look at them. Honestly, the rudest teeth. If you had to pick the rudest tooth, what would it be?
Definitely. Yeah, so week 3 had another really good webinar. We went through quite a lot. One of the tips that I'll give you is if you're doing extractions of the same tooth but on the contralateral side, then go, and one's hard and one's easy, or one looks easier, then go for the one that's easier first. Assess the bone density and get a feel for how the bone expands and reacts to the tooth being extracted. And then once you've done that, you have a better idea of how to tackle the harder one on the contralateral side. Okay, and I'll see you guys in week 4. Bye.
It's a case of trying to close over this was going to be a challenge, and choosing the right sutures to close with is really important as well. The whole variety of sutures that we can use that we'll talk about very shortly.
So this was week 4. We covered how to do surgical extractions from start to finish, raising flaps, flap designs, bone removal, sectioning of teeth, suturing materials, how to suture, suturing methods, and flapless surgicals, and so much more, to be honest. Some things that I learned from today: if you have a close relationship to the inferior alveolar nerve from the 8, then there is a 1% chance that you'll cause permanent damage and a 5% chance that you'll cause temporary damage to the inferior alveolar nerve. I learned that 15C blades are a little bit thinner than 15 blades for making incisions, and so that's a little bit nicer. Another tip for better soft tissue healing is to use Prolene, a non-resorbable suture, instead of the resorbable Vicryl sutures that we usually use. And then one last little thing that I'll mention is that envelope flaps can be used in like 90% of the situations. So I don't want to say if in doubt, but if in doubt, use envelope, but don't do anything if you're in doubt. But yeah, okay guys, I'll catch you guys next week. Bye.
So for week 5, I wasn't actually present for the webinar. Luckily, Dr. Muhsin and Dr. Tahid record the webinar, so I just caught up later. In this webinar, they spoke about wisdom teeth extractions and CBCT imaging.
Hey guys, week 6, we're dealing with complications. We've covered quite a lot so far. OACs, OAFs, nerve damage. We've spoken about maxillary tuberosity fractures, how to deal with all of these things, bleeds, arterial bleeds, quite a lot actually. This week I probably won't give any tips because quite a lot of it is quite complicated, and there's a workflow to most things in terms of how to manage each of these complications. So it's not really a tips kind of week, but it's been awesome, honestly. This is the last webinar and I'm looking forward to the hands-on day. So here we go.
So for week 7, we're very lucky actually. It wasn't in the schedule, but Dr. Tahid Hamid took us through how to actually place implants in preparation for placing implants for the hands-on day.
Hey guys, what's up? The big day's finally come. It's hands-on day. I'm headed off to Coventry now. It's about 6 in the morning. I should be getting there around 8:45. Might pick up some food on the way, and I'm really excited. Can't wait. Take care guys, see you in a bit. Hey guys, so I'm with the famous Dr. Muhsin and Dr. Tahid, and today we have covered so much. It's a hands-on day, and honestly, thank you guys so much. I've been taught how to do a buccal advancement flap. I've been shown an OAC and an OAC closure. I've been shown how to release a buccal fat pad and Yeah, and sinus graft as well, exactly. We've covered so much.
Great morning. So
yeah,
raising
honestly,
flaps,
phenomenal.
bone removal, suturing, different surgical techniques, all on cadavers, hands-on, one-to-one teaching.
Yeah.
So it's great having you. It's really
Honestly,
good fun.
thank you so much, guys.
Thank you. Thank you for coming down.
What, honestly, a great course.
Thank you.
So it's really hot. Stepped out for a little bit. Honestly, this course has been phenomenal. We just continued on in the afternoon. I've managed to extract a central incisor, placed a bone graft, then I placed a membrane. We continued on to see the floor of the nose, and then Dr. Mohsen was showing me how to actually utilize that area for implants, where you can actually bone graft in that area, slowly peeling back the sinus membrane or the nasal membrane. And honestly, you really feel like it's one-to-one. I know it's obviously not, but it's just constant support. I think it's like 4-to-1 or something for each 4 students. It's like 1 person, which is amazing. Top quality. Anyway, I'm gonna enjoy my tea. I'll catch you guys at the end.
Excellent. Buckle advancement flaps. Yeah. So periosteal release, understand? Making a tiny incision and just advancing it, pushing it with your periosteal elevator and stretching the mucosa over the top. Fat pad, everyone see the fat pad? Good fun. Good. Tuberosity fractures. Have we fractured any? No, haven't.
Hey guys, now that I've just finished the course, I want to tell you a bit about my experience. Honestly, I thought it was great. There was the weekly webinars, which were 2 to 3 hours. I think if that information was all packed into one day, I will focus for the first couple hours and then the rest will go over my head. So the fact that it was weekly meant that I had time to digest all that information. Because the webinars are recorded, it also meant that I could actually review all the recordings before I went in on the hands-on day. On the hands-on day, there was so much support. I've mentioned this previously. It felt like it was almost 1-to-1, and when Dr. Mohsen and Dr. Tahid came to support me, they would literally take me through every single procedure step by step. And the fact that it was on a human cadaver instead of a pig, for example, meant that I was really tested about the anatomy, and it felt like I could actually truly learn what they were teaching. I never really thought that you could learn so much from one course, but honestly, it really pleasantly surprised me. You can really tell that the teachers have a passion for teaching, and they're really good at breaking stuff down, simplifying it, and delivering it in a digestible way. So thank you guys for making it to the end of the video. If you haven't subscribed yet, make sure you subscribe, and I'm also going to leave a link for the course in the description, and I'll see you guys in the next video. Bye.